Good afternoon, everyone, and good morning to those that are joining us from places that are not on East Coast time. We're looking forward to a robust 40 minutes of conversation today and addressing some of the biggest challenges that we are hearing from our healthcare clients and how to potentially use your pension plan to help mitigate some of those issues. So we'll jump right in. It's a 12:01, so we want to make sure we use your time wisely. My name is Kate Peasy. I'm a partner and senior investment consultant here at Fiducient Advisors. I'm based in Connecticut, and I work with a number of healthcare organizations providing fiduciary advice on their asset pools, including their pension funds. So I'm thrilled to have joining me today two individuals that work with healthcare clients across the country to help both diagnose and treat their clients' pension plans. In many cases, utilize the pension plan as a tool to really help mitigate workforce challenges that are plaguing the healthcare industry today. So John Lowell and Phil Merdinger are both partners and consulting actuaries with October 3. October 3 is an actuarial firm headquartered in Chicago, and both John and Phil are based in Atlanta. I always like to find out some interesting tidbits about my fellow presenters. So interestingly, John claims to have 59 siblings. I'll say full disclosure, I have not fact-checked this, but certainly there is a backstory there. And in my efforts to back-check that, John shared a picture with me of some of those 59 siblings. There's John highlighted right there. And while still interesting, Phil, but perhaps less dubious, Phil is a former cowboy and can even rope cows. So while I don't have a picture to share, I'm sure those are some interesting stories there. So John and Phil, welcome, and really thank you for joining me today. Before we get started, a quick hit on some housekeeping. If you have questions, put them in the chat feature at the bottom of your Zoom meeting screen. The three of us will monitor and address those throughout our discussion. But if we don't get to your question, we'll be sure to follow up directly. And also, if you are interested in a complimentary wellness check of your organization's pension plan from October 3, which Phil will talk about in a little bit more detail, please reach out to Phil directly. We've included his contact information on the last slide as well. All right, so let's get right into it. John, I'm going to start with you. It's probably, I'll say, an understatement that hospitals and healthcare organizations are really facing some unique challenges coming out of the pandemic. Many of these are financial in nature. However, I'll say one of the most critical challenges that I've been hearing loud and clear, and which has really been an HR issue that has grown into a finance issue, is staffing. So one, what have you been hearing? And two, what are some ways hospitals may be able to address some of those issues?
Well, Kate, that's a great introduction. Thank you. And you are absolutely correct in staffing, or some people refer to it as attraction and retention of employees. Some call it workforce management. But that for quite a while now has been probably the number one issue on the HR side for hospitals. The really interesting thing is that has, according to recent surveys and things that we've seen in the literature, as well as conversations with hospital CFOs, that has bubbled to the top for roughly half of all hospital CFOs, at least that we're talking to. So half of them are putting what has historically been an HR issue at the very top of their list of challenges. The other two, and interesting, all of these things in one way or another can tie into the pensions. There's revenue cycle management, is the term usually used in the industry, but it's dealing with inflation. It's dealing with the mismatch in timing of when you're negotiating the revenues that are coming in versus when you are actually purchasing supplies. One has not reflected inflation, and that would be the one that would be helpful. The other has reflected inflation, and that's the one that's not helpful. And then finally, because of all of that, operating margins are under severe pressure. So two of those three are much more finance issues. One of them is an HR issue, which has become a finance issue. And then finally, I think I just saw this last week, more than 1/3 of hospital CEOs, so we are now talking chief executive, more than 1/3 of hospital CEOs are now saying that attraction and retention of employees and workforce management has become their single number one issue. That's really astonishing to me.
Wow.
And again, we think that the pension plans can tie very well to this. So we'll continue to focus on that as we go through the next 35 minutes or so.
So let's talk about addressing some of those challenges with the defined benefit plan.
So our presumption is that if you're on this webinar, you probably have or would like to have or used to have a defined benefit plan in your organization. Lots of hospitals have defined benefit plans. They tend to be organizations that have been around for a while, and at the very least, they were around when most good-sized organizations had defined benefit plans. As I'm sure you all know, many organizations have shed themselves of that because it was very trendy. Hospitals as a group, though, because of the cash crunches that they often face, are oftentimes not in a position to just write a huge check to get out of the plan. So there are lots of hospitals with legacy plans, and they are in many cases legacy frozen plans. But at the same time, there are also a fair number of hospitals with ongoing open defined benefit plans. And the two of them, while they have many similar characteristics, they also have some that are quite different. But a few things that are really important if you have a plan. How much do employees really get from the plan? And we're not talking in dollars and cents, but somewhat intrinsically, what is it that they're getting from that plan? Do they understand it? Do they understand what they will get someday? Do they place value on it? From a plan sponsor standpoint, one of the big complaints that we've been hearing for years, I've certainly heard it now for at least the last 30 years from hospitals, is this plan, the costs of it are so volatile. Is there anything I can do about that? Very much in our internal discussions, but also when we're speaking about pensions externally, and this goes to the idea of the wellness report that Phil will dig into a little bit deeper later on. Healthy pension plans can serve as a real competitive advantage. If you've got an ongoing healthy pension plan, it's not going to put an undue strain on your organization. But at the very same time, you'll be able to use it as a tool to help attract employees and similarly to retain those who are already there. So to manage your workforce better. A survey that came out a few weeks ago said that more than 1/3 of employees who work for an organization that currently have an ongoing pension plan absolutely will not leave to go to an organization that does not have one. So that tells you a good pension plan can be a very powerful retention tool, and for that matter, an attraction tool as well. But then there are the unhealthy plans, and we'll talk on the next few slides more about what it means to be healthy or unhealthy in the scope of a plan. But unhealthy plans can lead to really significant costs. They can lead to pressure on debt ratings, which in turn affects your ability to generate cash through borrowing. Unhealthy plans oftentimes have a pattern of contributions that look much like this. They go up, they go down, they go all over the place. And they're a real headache for the finance department, which then makes them later on a headache for the HR department.
Hey, John, a question came in just with regard to open versus frozen, closed and frozen plans. You talk about the competitive advantage by attracting employees or retaining employees. How about for frozen plans? I know many hospitals that I work with, their plans are frozen and have been frozen for, I'll say, a decade or more ago. However, I think there are some adjustments that can be considered to help make sure that the plan is not, I'll say, encouraging folks to leave, either through allowing for in-service distributions to be able to retain longer service employees for a few more years, or even addressing some rehiring policies of the current plan. So any thoughts on a frozen plan?
That's a great question, Kate, and you're absolutely right with that. The fact that you have a plan at all, if it's frozen and if it's well enough funded that you have some flexibility, you can do things within the plan to provide incentives for employees either to stay, or you can provide incentives if your older workforce is a little bit too large. You can provide those people with an incentive to leave, but on a very targeted basis, on a basis that is targeted not just necessarily to groups of individuals, but to specific timing. So for instance, if you anticipate that you're going to be overstaffed in late 2023, you could use a program within that plan to give people an incentive to leave in the middle to late part of the year. So there are lots of tools available. Probably going through the whole scope of them is more than we can handle in the amount of time we have today. But having a plan still is going to be much more valuable and much more useful than not having a plan at all.
Great. Well, hopefully our hospitals can get to the place where they are overstaffed in a near term. You talked a little bit about healthy pension plans. Any other comments you want to make around, really assessing whether or not your pension plan is healthy?
Sure. And, just like patients are, patients cannot necessarily be just broadly categorized as healthy or unhealthy. There's a continuum. Some patients are as healthy as you can get. Some patients are in critical care and hoping to not get any worse than that. But then there are all the ones who are in between. And we can think of pension plans much like that as well. A plan that is very well funded and has a strategy, so they know exactly how they are going to handle their finances moving forward. They're going to do it on a very systematic basis. And this can be whether they're frozen or whether they're an active plan. But in either case, if they're doing things according to a well thought out strategy, they're starting from a good place and making efforts to stay in a good place, then we would tend to categorize them as being a healthy or certainly healthier plan. But pension plans can be expensive to run, and the less healthy that a plan is, the more expensive that it becomes to run. So those plans that are worse funded, the way all the rules and laws around pensions work, the worse funded that you are, or the more unhealthy you are, the harder it is to get yourself healthy. And in a lot of ways, that's like a patient as well. The patient who has got 15 risk factors, to get them to being healthy is really difficult because you've got to address them one at a time and have all the other competing ones fighting against you. And it's that way with pensions too. But what does a healthy pension plan look like? An organization really understands why they have the plan and what they're doing with it. That's important. There's a strategy in place. And if the plan is not fully funded, there's a strategy in place to, on a very programmatic basis, move the plan from one funded level up to a better funded level, and to keep it there once it gets there. You're managing risk and volatility particularly effectively. Your investment advisors can help you with that. Your actuaries can help you with that. When your investment advisors and actuaries are working together and talking to each other and working in partnership, you tend to get even better outcomes. And then why do you have a plan? Well, you have a plan because you're providing a very valuable benefit for your employees. If your employees don't see the value of it, then you've got a problem. One of the things that we've seen around that is, how is the messaging done? So if you look at surveys, even if you look at something as simple and from a business standpoint, seemingly foolhardy as, what are your employees saying on social media? What words do they react positively to? What words do they react negatively to? And I'll give you an example. If you ask an employee if they would like an annuity, most employees will just groan at that. Annuities have a really bad connotation. If you ask them if they would like guaranteed income for the rest of their life, which to me sounds an awful lot like an annuity, they will love that. Those are really good words. So if your employees are not seeing as much value as you would like, think about it and recraft the message so it's exactly the same benefit, but craft the message in a way that your employees will see value from it. And the last thing, and I can't repeat this often enough because I already have, but a really healthy pension is a great way to attract and retain employees. There are a number of hospitals that I could name that if you look at their LinkedIn profiles, they are touting their pension plans several times a week. They're touting them both when they are trying to attract new employees, but also when they are trying to retain the ones that they have.
Great, John, really, really good information. I will say, unfortunately, though, I know many of the plans that we both come across are not as healthy. So maybe Phil, maybe you can kind of go through some of the symptoms, I'll say, of the less healthy plans and how you can go about diagnosing and treating those plans.
Absolutely. Thank you, Kate. And just to add something briefly to John's last comment, a healthy, strong plan can help you attract and retain people. And I think there's a misperception out there that pension plans are an expense. We don't feel that it's an expense. We feel that it's an investment that can provide a demonstrable ROI for what you're getting. Having a sound, healthy plan doesn't mean you need to be spending more money. It means you need to be in alignment with what you're doing. That said, let's take a look at out-of-shape pension plans. This is a fun area with it. And we're going to show you an example as we go along of someone who is really out of shape and probably ought to be checking themselves into the emergency room pretty quickly. But before we do that, if you take a look at what the common characteristics are, I usually refer to it as it looks and feels a lot like a ship lost in the middle of the ocean, getting buffeted around by the currents, no rudder, no sail, no engine, without a clear idea of where they're going to go, how they're going to get there. And we see this all the time in hundreds of plans we look at, and it doesn't need to be that way. We'll spend a little bit of time talking about that as well. But generally speaking, when we see something that looks unhealthy, there's a disconnect with the value that people are getting. People have a strategy of, I'll call it hope and despair, which usually isn't a very good strategy. And they feel like they're getting bounced around. Nobody likes surprises unless it involves getting a gift at the holidays or your birthday, and people get unpleasant surprises with their pension plans when they're unhealthy. Without a doubt, most all of the plans tend to be underfunded. And when I refer to underfunded, I'm looking at something on a market basis when I say that. And as a result of them being underfunded, they get another unpleasant surprise with PBGC premiums, variable PBGC premiums that can be extremely significant and not a fun thing to deal with. We see people missing opportunities to manage risk and cost. How can we take bets off of the table? How can we lower our cost? Because when you look at pension finance at a very simple level, what's the cost? It's the benefits you pay out, less the investment income you earn, and plus the investment that reduces it, and then the expenses you incur. And managing expenses, well, every dollar you pay out is a dollar less you're going to be able to get towards improving your plan's funded position. And the unfortunate thing with all of this is a lot of people don't realize that there's other ways to do things. This is not something that you have no control over. You actually can take control and you can change the future with it. So let's dive a little deeper into that if we can. And I apologize in advance. We're all actuaries. We like charts. We like colors. And we're not going to disappoint with the next few slides that we look at. But let me try to walk you through what we look at when we're looking at the measures of financial health. And this is in no particular order. What are the costs you're incurring to run the plan? PBGC premiums and the overall administrative costs are the key components. And this is a real life example. This isn't a contrived example. This is a real hospital whose name has been disguised to protect the innocent in the process. And when you look at what's happening here, you see a couple of really big visual takeaways. You see PBGC premiums that are going one direction, and that's not a good direction. You see overhead costs going one direction, and that's not a good direction. And more importantly, if you take a look at what these costs are as a percentage of assets, it's a very compelling story. So in this case, you're seeing a plan that's incurring 2% a year in carrying costs. Think of that as a negative 2% return on your assets. So you think you earned 8%? Well, actually, you didn't earn 8%. You earned 6%. So it's making it that much more difficult to get any improvements in funding of the plan. And that'll become really clear as we move on to the next page with it. I said nobody likes surprises, and the contributions here are a surprise. It almost looks a little bit like a random number generator. They're up, they're down, they're all across the board. So that's what you see with the light blue bars. And if you look at the red line going across, that's what's happened with the plan's funded position. We're looking at it in a different way, and this is a real good measure of some of the health issues. You're putting a lot of money into the plan in a very erratic pattern, which makes it extremely difficult to plan. And after all the years of putting the money into the plan, you're no better off than you were at the beginning of the period from a funding standpoint. That's a red flag that you definitely want to look at. What are you doing to try to optimize the balance of risk volatility? What bets do you want to leave on the table? Plans that are not healthy typically have missed opportunities to try to right-size the plan, to de-risk the plan. That's another key measure. So if I can draw your attention to the upper right corner, we're looking at what the liability profile is for this plan. This is a plan that has lots of inactive participants. This is a plan that has been frozen. And I'm going to come back to the relevance of that in a second. You have almost all your liabilities for people who no longer work for you. The average benefit that people are getting is really on the small side. The plan's underfunded and you're paying huge PBGC variable premiums, and you've done nothing to de-risk the plan. Or put it in a different way, would it make sense to try to shrink the plan down, to look at ways of reducing the headcount through maybe selective lump sum windows, annuity purchases, reduce your headcount, reduce your PBGC premium. And if you look at what's actually happened, which are the numbers appearing to the left, they haven't done anything. So there's an opportunity, but it's an indication of a plan that isn't behaving in a very healthy way. And if you really like lots of numbers in different colors, and we look at the bottom chart, what we're doing is showing what's happened to the change in funded status over the past 10 years. And I want to draw your attention to a couple things in particular. If you look at the bars above that solid line, that's the money that's going in. If you look at the bars below the solid line, that's the money that's going out. And if you look at it, you see that in many years, what's going out is greater than what's going in. That's another indication of plan health. And by the way, with the frozen plan, it's not a sustainable model to have the money going out constantly exceeding the money coming in when the plan isn't very well funded. And if we move on to the next one, everybody likes to know how we compare to everybody else. And this tells a very compelling story here too. This represents a benchmark database we have of all the hospitals and looking at funded status. And as you can see in this case, they're probably down towards the very bottom of what's going on within the broader based universe of hospitals. Again, a red flag.
Hey, Phil, a couple of questions have come in. So I think a lot of great information that you've been able to pull together on Hospital X. But the question was, what should I look at first if we've really never looked at this before? So a lot of information that may be overwhelming, kind of where should they first focus?
That's a great question. I think where you want to first focus is you need to understand where you are. You need to understand where you're going. A snapshot saying a plan's poorly funded is helpful, but understanding what's going to happen if you do nothing is also perhaps more important. Windshield can be more valuable than the rearview mirror with it. Understanding what can go wrong. What's going to make things get better or worse? What are the levers we can pull? How can we change the future with it? So I think that it's a two-step process. Let's see where we are and understand how we got there. Let's look and see where things are headed and what we can do about it. And I've yet to see a situation where you can't change the future in a positive way. Did that answer the question?
Yeah, I think that's great. And I think you've laid out, a lot of the different components very well, particularly around that PBGC premium, which is essentially a tax on the pension plan. And then looking forward as to ways to kind of be able to reduce that. Hopefully there's some low-hanging fruit there.
Absolutely.
The other question is, if they're interested in getting a complimentary wellness check, how much information do you need from us? I think that's a really great question.
That is, and it's a very easy answer. Let us know who you are, how we can reach you, and what the name of your plan is. And that's all. We do not need any data of any kind. We have the ability through the forensics tools we've created to gather everything that we need.
Aha, that's fantastic. I think probably music to a lot of plan sponsors' ears if there's not much that they need to do. If the answer is not much.
Yes, it's very simple. So let's flip into what do you do? We've talked a little bit about that. We can't overemphasize the importance of having a strategy. A strategy doesn't mean we're going to get to wherever we're trying to go tomorrow. A strategy is a plan. Plans get updated, plans change as situations and circumstances change, but there needs to be a path, whatever that is. And that path is going to inform what possible options are available. There's no one right way to get from Chicago to Atlanta. There's some clearly wrong ways. You don't want to go to Los Angeles first, although I've had that happen with planes. You want to look at what paths make the most sense. And you want to understand as you're going down that, what are my liabilities? What are my assets? What level of risk am I comfortable with? And how does that inform where you want to go? And how are we aligning what we're trying to do with the business? It's back to my point earlier. This shouldn't be viewed as an expense done the right way. It's an investment that you're going to reap a return on with it. And I can't emphasize enough the issue of frictional costs. It's a clear measure of an unhealthy plan. It creates significant headways to making progress. And when you're in a situation where 2/3 of every dollar you're putting into the plan is going right out the other end to pay expenses, that's not a good place to be. So I'm going to pause there for a second. And then let's move on and talk about how liabilities and assets fit together.
Great. Thanks, Phil. So I'll jump in here and really connecting some dots on what Phil just talked about on mitigating risk and making sure that the pension is aligning with the hospital's objectives. To help mitigate pension risk, really by focusing on the plan's investments, is a lot of times how we partner with a hospital in conjunction with the actuary. And what we think about on the investment side is achieving risk mitigation through employing a liability-driven investment or LDI framework. And the goal of an LDI framework is to reduce the overall volatility of the pension plan on the hospital's financials by allocating a portion of those assets to investments that move really in tandem with pension liabilities as interest rates change. And that's called a liability hedging allocation. However, it's not black and white. Striking the right balance between both liability hedging and then more, I'll say, traditional return-seeking investments varies for each organization. And it should vary. It's not, and it really cannot be viewed as a one-size-fits-all solution. And we've kind of developed this strategy dashboard, if you will, to help identify or to help really promote the conversation around the major considerations when we think about how to strike that right balance. And it depends on many factors unique to the hospital in its overall financial picture. And those are listed here, which I will not go through in painful detail, but just on an example, if you look 3/4 of the way down at the EROA sensitivity under the plan sponsor constraints, that stands for the expected return on asset assumption. If an organization that's very sensitive to the impact of the annual cost on the pension plan on the hospital's P&L or their income statement, that's going to help inform that asset allocation decision between the return seeking and the liability hedging framework, liability hedging allocation as a part of this LDI framework. So as I mentioned, there's a lot of factors that we're highlighting on this page, but I think really the underlying takeaway here is it's really critical to be able to work with partners that understand these nuances of pension plan management, say both on the liability side and on the asset side. So I don't see any other questions coming in on this point on this slide. So Phil and I think, hit on the importance of really understanding where your pension is today, defining those goals, and also managing the risk, both from a liability side as well as from an asset side. But John, maybe you can close us out by hitting on some of the things that hospitals can think about from more of a forward-looking perspective or a plan design perspective.
Sure. Thank you, Kate. So as I said earlier, what's the point of having a pension plan for your employees? Well, presumably, it's to give them a benefit that they are going to appreciate and really has some value for them. As we oftentimes like to express it, what we're really trying to do when we are advising plan sponsors on what they should do with their pension and why they should have a pension, well, in total, they want to provide good outcomes for their employees, particularly the ones who are going to be with them for quite a bit of time, and not just their current employees, but their yet to be employees who will be their employees a year from now, 5 years from now, 10 years from now. So what we are trying to do is we are trying to build these plans of or for the future to help you in attracting and retaining your workforce of the future. But it's not just employee outcomes, it's also outcomes for the organization. If the outcomes for the organization are that your plan is affordable and your plan is sustainable because it remains affordable with very constant costs. That's an outcome that most employers can and are willing to live with. So that was one of the problems with the plan designs from the 70s and 80s. They don't provide that consistent level of costs. And that inconsistency in costs has a habit of making finance chiefs very uncomfortable. So the designs we're looking at today, they look much more like a 401k or 403b plan. They tend to be account-based. But what they do is, if you think of your savings plan, whether it be 401k or 403b, if you think of your savings plan as a way for employees to grow some level of wealth, but your pension plan as a way for them to grow some level of lifetime income, even if it's expressed as an account balance, then you have two accounts running in parallel. So they're side by side with each other. They each have slightly different purposes and they have slightly different focuses. Now, one of the problems that we had with these designs as well is the rates of return have always been tied to things which are not really hedgeable. So if it's a great design up from the liability side, it might be a horrible design from the asset side. And Secure 2.0 has helped to fix that for us. There was one little sentence in there. It was hidden in almost all the literature that has come out, but it is now allowing us to design these plans in a way that does provide great benefits. It enables workforce management. It allows you to attract employees, oftentimes earlier in their career, retain them later in their career, and then phase them out when they're ready and when you need to. So it accomplishes all of those things. And while doing so, it produces extremely predictable and consistent costs. So I think that in many, many ways helps to solve, or maybe completely solves in some cases, a lot of the challenges that hospitals and frankly other organizations as well are facing. But when you think about it, your pension plan does cost money. But what costs more money than your pension plan? Unwanted turnover. Unwanted turnover is often the single biggest non-budgetable but burdensome cost that an organization has. If you've got a plan that people do not want to leave, and remember that data point that I shared earlier, people who are working for an organization that has a pension tend not to want to leave there for an organization that does not have a pension. So if you can keep employees and reduce that unwanted turnover, particularly at inopportune times, you may more than pay for your pension in other ways while providing, again, those great outcomes for your employees as well as for yourself.
Great. That's incredibly helpful information. One more question, John, that had come in is, if a hospital is interested in exploring this further, especially with the kind of the critical concerns that are happening, how quickly could a plan like this or that you're talking about here be implemented?
It's not particularly a long process. So much depends really on how quickly an organization is willing to move. Are they willing to have discussions right away? Is their internal decision-making process fluid enough that they can take recommendations, get them to the appropriate people, and develop a plan for rollout and communication quickly? It could be as soon as, it depends a little bit on where they are right now, but it could be as soon as a few months. It could be as soon if it's an organization that moves really slowly and they put up the barriers. It could take several years, and I only say that because I don't want to promise a few months for somebody who is not being quite as cooperative on their end as we might like.
Great. Very helpful, though, from a timing impact, that it is something that really can be implemented in relatively short order if all of the pieces are in play there. So We're closing in on our time together. Thank you, John and Phil, for sharing some of your expertise, I think, around these really critically important issues that we hear are impacting many healthcare organizations and many of our clients today. And some thoughts around being able to utilize some tools already maybe in their toolbox set that perhaps they don't realize to help address particularly some of those staffing concerns. So with that said, I will say a little plug for Fiducient in October 3. We have some great resources available on demand by visiting our websites, and I definitely encourage you, if any of this sounded interesting, please reach out to Phil for that complimentary wellness check. As I like to say, knowing is half the battle. And also thank you to everyone who could join today. If you have any questions, feel free to reach out to myself, John, or Phil. So with that, thank you, everyone, and be well.